Denise DePape is with us this evening. After a long career in public health in Ontario, in 2008, Denise DePape joined the BC Ministry of Health as the Director of Alcohol Harm Reduction. She is a member of the Advisory Committee for the National Alcohol Strategy, which recently developed the first pan-Canadian low-risk drinking guidelines. Denise is currently managing a project to facilitate the development of municipal alcohol policies in BC local governments. Other major projects involve problematic alcohol use on university and college campuses and online resources for parents to help their children make healthy choices with respect to alcohol. Welcome, Denise.
Good evening, everybody. I have an interesting task. I'm not going to talk to you about what we're doing in BC to prevent FASD. I'm going to talk to you a little bit about the center of the flower, the center of the prevention model. General alcohol policies that governments enlist or engage in or put in place. And we don't, those of us working in FASD don't think about these things generally because these are not the responsibility of the Ministry of Health. But I'm here to tell you that they have a big impact. And the first point I've got up there is really important for understanding what this is all about. As our population consumption goes up, so do all the alcohol-related harms. Alcohol-related injuries, alcohol-related chronic diseases, and FASD. And so what we need to do is be putting in place policies that reduce population consumption. And we're not doing a very good job of that in this country. So here's a bit of a context. Now, you've heard these terms: supply reduction or management, demand and harm reduction. You've heard these in terms of illicit drugs. We have spent most of our time directing our energies to demand reduction and focusing on individuals and trying to convince individuals to reduce their consumption of alcohol or to stop drinking altogether or not start it. And not enough on the environment, the supply of alcohol, the environment. We need to create an environment in which it's easier to make healthy choices. So we need both of these things. We need women and the rest of society need information, but we can't be making liquor available in every corner store, which is what lots of our provincial governments would like to do. Okay, good, thanks. So anyway, as I said, we need a balance, and I put health promotion at the bottom of the slide because if you just focus on supply management and demand management and harm reduction, in fact, that's really a disease model, and of course, all of you in the room know that women's lives are much more complex than just focusing on a disease or a condition or whatever else. And we need to be approaching people and dealing with them where they're at and helping them improve their health. So we do need to have that. Now, so I represent the government of BC. In BC and in all of our other provinces and nationally, with a lot of effort and a lot of money, over the past 30 years, we've had a huge reduction in tobacco use and tobacco-related harms and costs to our society. In BC, we've been able to demonstrate that tobacco-caused hospitalizations are going down, but alcohol-caused hospitalizations, that's from a whole variety of things. That's injuries and chronic diseases and alcohol-related mental health conditions and so on. They're going up, and they're projected to cross over in the near future. So we need to be looking at what we've learned from tobacco and taking a comprehensive approach. And so people in communities who are dealing with FASD need to find ways to engage the Ministry of Finance and other parts of government that are putting in place policies around price of alcohol and so on. We need education, but like with tobacco, we did skills building, we did support programs, we had policies at the local level and legislation at the provincial level. We need to do the same thing in Canada and in each of our provinces around alcohol, and in fact, we're going the other way because most of our governments are talking about deregulating alcohol, and lowering the drinking age is on the table in Saskatchewan and various other things. So the WHO has a global alcohol strategy. Canada has signed on. We do have examples of successful policies in Canada that we need to be putting in place. So the government of Saskatchewan recently changed their whole pricing structure and priced alcohol according to the volume of alcohol in the product. And they pegged it at the equivalent of $20 per liter of pure alcohol. What it did was raise the price of all the high alcohol, cheap products that were being consumed by vulnerable groups. The impact is twofold. They've reduced hazardous drinking and they increased government revenue. Now that's been demonstrated and published, but they're not very proud of it, I don't think, which is really too bad. We have a moratorium on increasing the number of private sales outlets in BC. That's a good thing. The other thing that's evidence-based that we really need to be looking at is screening and brief intervention. BC has their own tool. The National Alcohol Strategy Table has just released a new online tool for physicians and healthcare providers that the College of Family Physicians of Canada has embraced and they're promoting. So one of my messages to you is that we need to be working, me from the alcohol policy community and you from the FASD community, we need to be communicating. I need to help you understand why you need to talk to your brother-in-law about why it's a good thing to raise the price of alcohol. There's a ton of evidence that says when we raise the price, and certainly only within, you can't raise it astronomically and assume you're going to have an impact. But anyway, we need to be strengthening each other's work. And then my one last thing to show you is we are doing nothing in Canada about alcohol marketing. And this is what the alcohol industry is doing. And they are directing a lot of their marketing at young people, but young women. And so an example from BC is 80% of the cooler market in BC is 7% alcohol, and it costs less per volume of alcohol than the 4% products. We need to do something in around pricing of coolers and other products, and beers too, but other products that are appealing to our young people so that when they choose, they will choose the lower strength products, which frankly I understand don't really taste any different. So anyway, there's my little plug for embracing alcohol policy and for all of us working together.